lockdown by zone is 41 in Zone 1, 8 in Zone 2, 13 in Zone 3, 135 in Zone 4, 1 in Zone 5, 3 in Zone 6, and 2 in Zone 7. Now, I know that a lot of what we're expecting to hear about today is whether Dr. Russell will decide whether or not the lockdown will be rolled back to perhaps a red level of recovery in Zone 4, and if Moncton, which has been in the red level since mid-January, will potentially move back into the orange level with most of the rest of the province. Now, what she has said in the past and also late last week was that they're hoping to see both those zones get down to up to about 3 active or new cases a day. That would be about what she's looking for when determining whether there will be any move to a less restrictive zone, or level of recovery for those 2 zones. So I'm not sure what to make of how the weekend went, how she will see that, and how those decisions will be made. If we look to Saturday, there were 12 new cases on Saturday. So while yesterday was single digits, there were still double digits on Saturday, and double digits in Zone 4 as well, which had 10 active cases. And then on Saturday, there was 1 in Zone 3 and 1 in Zone 6 as well. So we should be starting on time today, but again, what we are really expecting to hear about is the reassessment of Zone 1, that's the Moncton zone, and Zone 4. There's also 7 people currently in the hospital right now, 2 of which are in the ICU unit, and that's quite high compared to what we've been looking at in the past couple months. It's usually been maximum just a few, so 7 in hospital right now with COVID-19 is quite substantial for New Brunswick. And again, we should be expecting to hear about a reassessment of Zone 1 and Zone 4 today, but a lot of you have written in with questions about the modified orange level. As we all know, it's probably going to be like this till at least we see all long-term care homes vaccinated. That's one of the goals I think they have in mind before we ever assess going back to yellow in any major degree, although the new orange level, as we've talked about, some people are calling it cantaloupe, some people are calling it tangerine. It's a little bit of a mix of yellow and orange. So a lot of questions we received in the last week have been about the steady 10 and what that means now. And a lot of you were curious if that means if you're in, let's say, Zone 2, if you have friends and family in Zone 3 that are both in the orange level, are you able to include people in those zones in your steady 10? Now, as far as I know, it's gray. It's a pretty gray area. They would prefer people not to travel between zones, but depending on the number of questions we have today, it's in my top 2. So just because of how many of you wrote in with those questions. So I think that's possibly what I will ask today, depending on what's said in the conference, depending what people say before me. But we are looking to start on time. It's 2:30 right now, so I think we're just moments away. Bruce, the moderator, has already done the roll call. It seems like it's a pretty big press conference. It's at sort of a level where we could possibly have 2 questions each. It might be 1. Depending on how long they want to take. Oh, we're about to start. I will join you after the conference. See you momentarily. Big press conference. It's at sort of a level where
COVID-19 in New Brunswick. Speaking on behalf of the province are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honourable Dorothy Shepherd, Minister of Health. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dorothy Shepherd, Ministre de la Santé. Dr. Russell.
Thank you, Bruce. Merci. Bonjour à toutes et à tous. Good afternoon, everyone. La zone 4, soit le nord-ouest du Nouveau-Brunswick, est en phase de confinement depuis 15 jours pour ralentir la propagation de l'éclosion de COVID-19. Cette mesure a causé de nombreuses difficultés à la population. Les activités commerciales ont été ralenties, les élèves ne pouvaient pas aller à l'école et il était impossible de fréquenter certains amis et membres de la famille. Je tiens à remercier les citoyens de la zone 4 qui ont respecté avec diligence les consignes et les recommandations de santé publique au cours des 2 dernières semaines. C'était tellement apprécié. Vos efforts ont porté fruit. Santé publique a recommandé au cabinet que la zone 4 quitte la phase de confinement et passe à la phase d'alerte rouge du plan de rétablissement du Nouveau-Brunswick à compter de minuit ce soir. Du même coup, nous recommandons que la zone 1, soit la sud-est du Nouveau-Brunswick, passe à la phase alerte rouge à la phase d'alerte orange sous les mêmes conditions qui sont déjà en place dans les zones avoisinantes. Zone 4 in northwestern New Brunswick has been under lockdown for the last 15 days to slow the spread of the COVID-19 outbreak. And I know this measure has created many, many hardships. Business activities have been affected, students have been unable to go to school, families and friends have been kept apart. And I want to thank all of the people in Zone 4 for their diligence in following public health advice and guidance over the last 2 weeks. It is so very much appreciated, and your efforts are paying off. Public Health has today recommended to Cabinet that Zone 4 move out of the lockdown and into the red alert level of our provincial recovery plan. And this change goes into effect at midnight tonight. And at the same time, Zone 1 in southeastern New Brunswick will move out of the red alert level into the orange alert level on the same conditions as are now in place in the surrounding zones. And so thank you very much to those people in Zone 1 who have worked so hard and really followed the public health guidance. It's really very much appreciated. But this does not mean that the virus has been eradicated. It does not mean that people can cast aside their masks and go back to life as it was before the pandemic and before these outbreaks. What it means is that the risk of transmission of COVID-19 in these zones is less than it was 2 weeks ago, but it is not zero. The risks are still there, and the risks of the variants are still there, and we need everyone in every zone, in every part of New Brunswick, to continue to follow public health guidance. Case numbers are now trending in the right direction, but we must all remain vigilant, particularly with this arrival of the new variants of COVID-19, which can be transmitted more easily and spread more quickly. They are so much more dangerous because many more people will be affected. We still have ongoing outbreaks in nursing homes in Zone 4, which our teams are working tirelessly to bring under control. So a big shout out to everybody working in the nursing homes right now that are affected. We are still seeing transmission in workplace settings in Zone 1, which does remain a significant concern. Le nombre de cas diminue à l'heure actuelle. Nous devons cependant tous continuer à faire preuve de vigilance, surtout en raison de l'arrivée des nouveaux variants de la COVID-19 dans la province, qui peuvent se propager plus facilement et plus rapidement et infecter bien plus nombreux de gens. Il y a toujours des éclosions dans les foyers de soins de la zone 4 et nos équipes travaillent sans relâche en vue de les maîtriser. Alors, un gros merci pour tout leur travail, tous leurs efforts. Nous constatons qu'il y a encore des cas de transmission du virus dans ces milieux de travail de la zone 1 et cette situation est extrêmement inquiétante. We are seeing progress, which is sufficient for us to recommend the relaxation of the stricter measures which have been imposed in these 2 zones. We are proving once again our collective determination to limit the spread of these outbreaks whenever and wherever they occur. I did an interview this morning on Radio-Canada, and the interviewer referred to it as a recipe for success. So I agree. We do have a great recipe for success here. And every New Brunswicker can take pride in that success that we are seeing today. I am extremely proud of the continued and ongoing extraordinary efforts and sacrifices that New Brunswickers are making. Aujourd'hui, j'annonce qu'il y a 2 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il s'agit du plus faible nombre de cas que nous ayons eu à signaler depuis le jour de l'an. Les 2 nouveaux cas sont dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin. Il y a présentement 182 cas actifs de COVID-19 au Nouveau-Brunswick, avec 7 personnes hospitalisées, dont 2 aux soins intensifs. There are 2 new confirmed cases of COVID-19 in New Brunswick, and that is the lowest daily number that we have reported since New Year's Day. And I am so grateful for the work to accomplish all of this that everybody has been doing, and I'm thoroughly impressed. The 2 new cases are in Zone 4, which is the Edmundston, Grand Falls, and St. Quentin area. And, you know, when I referred to the reporter's comments about the recipe for success, we're not seeing this type of pattern to the west or to the south of us. So again, we can't take this for granted. It really is a great accomplishment. There are now 182 active cases in New Brunswick, which include 7 individuals in hospital, and 2 of these are currently in intensive care. And behind these numbers, as always, there are people with families and friends who are deeply concerned about them. Please keep them in your thoughts and prayers as you go about your day. To limit the spread of the most recent outbreaks, we have had to reimpose some restrictions on rotational workers. Now, rotational workers had been categorized as essential before in terms of how we were counting cases, and we also know that with all travelers, any type of reduction in risk is important at this time. And I know that that has created very many difficulties for workers and their families. As you know, this past summer, we did relax measures around rotational workers, knowing that it was very, very difficult on their mental health. So please understand that we don't take this lightly, that these sacrifices in terms of following public health measures right now, I can't put myself in your place, but please know that we would obviously love to avoid this situation, but the risks are so very high right now. And I do actually have a relative who is married to a rotational worker, and I've heard the stories of him self-isolating in a different house and how terribly difficult it is on their daughter. And it's just really heartbreaking. So I do hear how difficult it is, and I want to thank all the rotational workers and their families for these sacrifices that they're making to keep all of New Brunswickers safe from COVID-19. And so if you know rotational workers, give them a shout out. Show them your support right now. They need it more than ever. I recognize that rotational workers are bearing a heavier burden of this fight compared to others. And I want to assure you that these measures are necessary. And again, I just want to acknowledge how challenging it is. Again, I can't put myself in your shoes, but I definitely understand that this is a very, very difficult position to be in right now. COVID-19 and its variants are very prevalent in other parts of Canada and in the world. And so, through no fault of anyone's, people who are traveling are at higher risk of becoming infected and therefore at a higher risk of bringing COVID into the province. And that risk has been escalating since the summer. And you can almost see an increase in the total number of travel-related cases as the risks around us have continued to increase. So there hasn't really been a difference in the number of travelers, but each traveler brings more risk because the risks in all jurisdictions have increased so dramatically. And now with the variants at play, it is even much of a higher risk at this moment in time. So we want people to keep working, but we don't want the virus to spread. And a full 14-day self-isolation away from other family members whenever that is possible is the most effective way to prevent infections from spreading. And we saw that this past summer. Every single case that had been self-isolating for the full 14 days and was tested on day 10, any of the people who became positive for COVID-19 did not transmit to any other person. So that is the only way to contain it. I am grateful to everyone who is following this advice. It is saving lives. And I think that's what's making me so nervous right now about the variants, is that what we've seen in other provinces, including Ontario, is that the vulnerable population in long-term care facilities is really at a higher risk at this moment and will continue to be at a higher risk until we can get them vaccinated. We have learned very hard lessons about what happens when people travel, what happens when people don't get tested for mild symptoms, and when people attend gatherings or a workplace setting. À l'approche du congé de mars, nous avons la chance de pouvoir mettre en pratique les leçons que nous avons apprises. Pour bien des gens, la première semaine de mars constitue l'occasion de s'évader vers des climats plus chauds ou simplement de s'éloigner de chez soi pendant quelques jours. Cette année, il faudra faire les choses différemment. Les voyages à l'extérieur du Canada ne sont certainement pas recommandés et nous déconseillons pour l'instant les voyages dans les autres provinces. Nous souhaitons également qu'il y ait moins de déplacements à l'intérieur du Nouveau-Brunswick pendant le congé de mars. Nous conseillons à tous les citoyens du Nouveau-Brunswick de profiter du congé de mars, mais de le faire près de chez eux. Les citoyens ne devraient pas voyager à l'extérieur de la zone dans laquelle ils résident. With March break approaching, we have an opportunity to apply the lessons that we have learned. For many, the first week of March is an opportunity to seek warmer climate or just to get away from home for a few days. And this year, things will have to be different. Travel outside of Canada is definitely not recommended, and we would discourage travel to other provinces at this time. We also want to see less moving around within New Brunswick over the March break. Our advice to all New Brunswickers is to enjoy the March break holiday, but do it close to home. People should restrict their travel plans to within the zone where they reside. By limiting travel within the province, we are reducing the opportunity for the virus to spread and new outbreaks to occur. Keep your activities local and share your fun with your steady 20 close contacts. And remember that those close contacts are the people that will be self-isolating when you test positive or one of them tests positive for COVID-19. There are lots of ways to enjoy the March break in your home areas, and I encourage everyone to take this opportunity to more fully explore your corner of New Brunswick. As tired as we all are of this pandemic, this is not the time to relax. It's actually the time to actually double down in our efforts, because every single protective measure that we have in place from a public health perspective is just one part of the solution of staying safe and reducing our risks. So we need each and every one of those pieces of protection augmented and amplified right now and strengthened. So please continue to use well-made, well-fitting masks when you're out in public. Remember to maintain 2 meters of physical distance from others. Watch yourselves and your families for symptoms of COVID-19, and when symptoms emerge, arrange to get tested. Remember that there have been virtually no cases of influenza reported in New Brunswick this winter, so if you think you have the flu, it's more likely that you have COVID-19. We are making progress, and we have this great recipe. Great people doing great work. We will get our most vulnerable people vaccinated, and we see very positive trends in areas in case numbers where they have been able to vaccinate their population. So we will get to a better place, but all of this will take time. And more than ever, we need everyone to keep doing the right things so that our progress can be sustained. Focus on the positive. Focus on what we have done. Focus on what we have and what we can do. Nous faisons des progrès. Nous réussissons d'immuniser les personnes les plus vulnérables de la province, mais avant que ça arrive, je m'inquiète beaucoup. Les variants posent des dangers tellement élevés et c'est pour ça qu'on est inquiète jusqu'à temps que les vulnérables soient vaccinés. Nous réussirons à revenir à une vie plus proche de normal. Je ne sais pas quand ça va apparaître dans les prochains mois, mais même avec tous ces défis, je sais qu'on peut travailler, on peut traverser, on peut passer à travers de ces défis ensemble. Mais il nous faudra du temps pour y arriver. Plus que jamais, il faut que chacun continue de faire des bonnes choses, leur mieux que possible, pour que nous puissions poursuivre notre progression. Thank you very much.
Merci, Dr. Russell. Merci, Bruce. Good afternoon. Bonjour. Over the weekend, 2 residents of Edmundston region died as a result of underlying conditions, including COVID-19. On behalf of all New Brunswickers, I wish to extend sincere condolences to their loved ones and to their community. Our thoughts and prayers are with you as you grieve this loss. The pandemic has made for a challenging start to the year for our province. But as always, when faced with a challenge, New Brunswickers stepped up. Residents in Zone 1, the Moncton region, and Zone 4, the Edmundston region, followed the directives of public health and did what needed to be done to slow the transmission of the virus. That is why Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of public health and are moving Zone 1, the Moncton region, to the orange alert level, and Zone 4, the Edmundston region, to the red alert level, effective as of midnight tonight. As a reminder, at the red alert level, you must stick to your household bubble. However, the move to red will allow more retail establishments to open in Zone 4, the Edmundston region, with an operational plan. Schools in Zone 4 will reopen this week, with students in the Francophone district returning to the classroom tomorrow, and those in the Anglophone district on Wednesday. At the orange alert level, close contact businesses like gyms and salons can reopen in Zone 1, the Moncton region. Residents in that region will now be able to spend time with their household and up to 10 additional people, your steady 10. These people cannot change from one week to the next. Think of it this way. If anyone in your home chooses to go to the home of a friend and spend time with their family of 4, those 4 people are now a part of your household's steady 10. Your household and members of the steady 10 can also go to public places that remain open under the orange level, including dining out at restaurants. Restaurants must continue to keep a list of names and contact numbers of those dining to assist with contact tracing, should contact tracing be necessary. We understand that people want to see their family and friends, but we must keep our contacts as low as possible. The steady 10 allows greater freedom in the orange level, but will keep contact numbers low and make contact tracing easier if someone becomes infected. The move to the red alert level in Zone 4, the Edmundston region, and the orange alert level in Zone 1, the Moncton region, are positive steps forward and take us closer to moving our entire province to the orange alert level. I want to thank everyone who has worked so hard to make this happen. Today's announcement is a reminder of what is possible when we all work together for the greater good, with a goal of keeping one another healthy and safe. New Brunswickers should be proud of what we are and of what we have achieved, but we must not lose sight of what is ahead. Residents in Zone 4, the Edmundston region, have made great progress, but there is still more work to be done before Zone 4 can move to the orange alert level. Residents in the other zones must also stay vigilant, as we have seen how quickly this virus will spread, given any opportunity to do so. We must not give it that opportunity. COVID-19 has already taken too much away from us, and it is only growing stronger. We have 3 confirmed cases of the UK variant of the virus in our province, and are awaiting the test results of another possible case. As Dr. Russell said, this variant has the potential to spread more quickly. We know the higher number of people who become infected means the higher number of people who will have lingering effects from the disease, and sadly, the more deaths we will have. We've seen what has happened in other jurisdictions, and it would be naive to think it couldn't happen here. It is more important than ever that all of us follow the directives of public health, that we wash our hands, maintain physical distancing, wear face masks as directed, get tested when you have symptoms, and stay home if you are unwell. Travelers coming into the province must self-isolate properly. These steps have been shown to make a difference. Every time we have seen a spike, New Brunswickers have beaten it back. Following these directives, along with the rules of the alert level of the region where you live, is how you can make a difference. All New Brunswickers have an important role to play in keeping our province healthy and safe. We must continue to make this effort in the weeks and months ahead as the vaccine is rolled out. As you know, the first phase of our vaccine rollout is focused on the most vulnerable residents in our province. We've taken a strategic approach to vaccinating our healthcare workers and staff and residents of long-term care facilities. Of the more than 27,000 healthcare workers in the province, including long-term care staff, 10,352 have received at least 1 dose of the vaccine as of Saturday, February 6th. Of the more than 11,000 residents in long-term care facilities, 2,840 have received at least one dose of the vaccine. This week, more than 2,900 healthcare workers are scheduled to receive their second dose of vaccine. And as well, more than 600 people are scheduled to be vaccinated at clinics being held in 8 long-term care homes. As of February 6th, 18,643 doses of the vaccine have been administered, and 5,347 people have been fully vaccinated. A reduction in shipments and shipment sizes impacts our ability to deliver vaccines to New Brunswickers. Staff are currently reviewing our vaccine rollout plan to determine how best to manage these reductions and adapt to the shortages. The revised plan will also give us a better idea of the order and criteria of priority groups. Our plan is, of course, contingent on the federal government being able to deliver the number of vaccines we have been told we will receive. With the supply in question, it is harder for us to give firm answers about how and when we will continue our rollout. Just know that we are determined to do so as quickly and efficiently as possible. We will update New Brunswickers as more information becomes available. It is important that we don't lose hope. It might not feel like we are getting any closer to the light at the end of the tunnel, but we are. Rather than focus on that, I encourage you to think about what you can do today that will make a difference in your life and in the lives of others. So much about this pandemic feels beyond our control, but we can take back some of our control by listening to public health and doing what is asked of us. That is where the power lies. That is how we will get through this. Thank you. Merci.
Thank you, Minister Shepherd and Dr. Russell. Merci beaucoup, Ms. Shepherd and Dr. Russell. We'll now proceed with questions from members of the media. You have the right to pose your question in the official language of your choice. Each reporter will have one question and one quick follow-up. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un court poursuivi. Voulez-vous assurer de désactiver le son de vos micros? Make sure your microphones are placed on mute. So we're going to truck along here and start with Laura Brown, CTV.
Hi, Minister Shepherd. I'm wondering, I can appreciate it's tough to know at this point how and when, as you said, people are going to get vaccinated in the next several months. But I'm wondering, your focus is in long-term care residents and healthcare workers. Who is next on the priority list for you? We're seeing CI clinics for those 80 and older. I'm wondering if it's now going to go to an age group.
So, Laura, thank you for the question. It's really hard to determine what the next Q2 is going to look like. We are so dependent on supply from the federal government that right now we are focusing on the priority groups for Q1, not knowing if we're going to have to overflow into Q2. So over the next several weeks, as we determine what that supply will look at, and using the most relevant information of the day, the task force will be determining what the next priorities will be, and we will address that at that time.
Ms. Brown, do you have a quick follow-up?
Yes, I'm just wondering if either Minister Shepherd or Dr. Russell has provided any guidelines for healthcare workers because of the variant. Any PPE guidelines or when treating patients in hospital, that kind of thing.
So there are ongoing discussions right now through the pandemic task force around those issues right now. And we don't have anything right now in terms of announcements, but just to know that the risks are being taken into account with those discussions around those very topics.
Thank you. Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. Première question pour Dr. Jennifer Russell. La Dia Desjardins menait une ronde de dépistage samedi, si je ne me trompe pas. Est-ce que ces résultats sont revenus négatifs? Y en avait-il d'autres positifs?
Alors, c'était pour quel foyer de soins?
Desjardins.
Alors, on attend toujours pour les résultats de la dernière dépistage. Oui, il y avait 119 échantillons qui ont été envoyés hier, alors on attend pour ces résultats.
Monsieur Hughes, do you have a follow-up? As-tu un suivi?
Oui, toujours pour Mme Russell. Dans la zone 1, retour en la phase orange, mais vous avez quand même mentionné que ce qui vous inquiète, ce sont les contaminations sur les milieux de travail. Est-ce qu'on pourrait avoir des exemples? Est-ce qu'on pourrait avoir des secteurs d'activité, par exemple, où il y a eu particulièrement de contamination? Juste pour qu'on comprenne c'est quoi le danger exactement.
Alors, je n'ai pas les détails comme tels sur les endroits, les lieux de travail, mais on sait que quand on voit des cas dans des endroits de travail, c'est toujours parce qu'ils ne portent pas leur masque, ils ont peut-être pas suivi exactement les protocoles dans les plans opérationnels qui sont en place. Alors ça, c'est d'habitude, ça c'est les sortes de transmissions, les raisons pour les transmissions qu'on voit, les lieux de travail ou les gens qui vont au travail, même s'ils ils ont des symptômes de COVID-19 puis ne se font pas tester et aussi s'ils n'observent pas la distanciation physique de 2 mètres.
Merci. Marie Sutherland, CBC.
Hi, my question's for Dr. Russell. I have a question about recovery numbers. We've heard about some long haulers who have recovered yet still have symptoms. How does public health determine that someone has officially recovered, or are they just automatically moved to the recovered category after 2 weeks?
So it's a really great question, and you're correct. On our dashboards, we talk about, once somebody is no longer considered to have active symptoms that require them to be either hospitalized or when they're out of their 14-day self-isolation and no longer contagious, they don't have symptoms. There are some places in the province that are capturing that data and at the national level as well. So there will be some more data available on that eventually, but you're correct that on our dashboard we don't have that information. My understanding is that there is some information in terms of the fact that, again, we have always, again, after that 14 days, we shift them to the recovery phase, with the exception of the variants, the cases that were diagnosed with the variant. Because we wanted to do a bit more follow-up on those 3 cases, we actually put them back into active case status.
Sutherland, do you have a follow-up?
Thank you. Yes, I do. I guess this would be for Dr. Russell as well. Rotational workers have told us they've tried to find out how many COVID-19 cases have been traced to rotational worker travel and how many to more frequent border cross-travel by workers deemed essential. Can you please give us the numbers for each of those categories?
So what I have said previously is that in terms of the numbers of cases that we saw in January, I believe I said about 35% of travelers fell into the category of essential workers, which included the rotational workers. In terms of breaking down the numbers further, I think what we really want the message to be is that we're trying to minimize the risks of anybody bringing COVID-19 into the province, period, whatever kind of travel you're doing. So when it comes down to truck drivers and other people who work on either side of the border for healthcare work reasons, our healthcare system can't function without those workers. So that is really important in terms of why we have the testing protocols in place for those people. And with respect to truck drivers, again, they are bringing essential goods, necessary goods in and out of the province that we can't produce here ourselves, obviously. So those are considered necessities and essential in that particular way. So what I can tell you is that all the risks have been going up since the summer. But from December to January, 35 of the 86 travel-related cases were from essential workers. But that number includes truck drivers, as well as healthcare workers and people who live on the border that have to come in and out of the province every single day. So, we're trying to get the overall number of travel-related cases down as much as we possibly can. And I know it's, as I mentioned, it's heartbreaking for people to be not in that position to be able to have those risks. And the risks have gone up since the summer. So in July, the risk situation was such that we weren't testing folks at that time. In September, we did introduce testing for rotational workers, daily commuters, healthcare workers, et cetera. And now the risks are that much higher. You could test on day 1, day 5, day 7, day 10, day 12. You will still get people who will test positive anytime during that 14-day period because it is a 14-day self-isolation period. And the only way to be 100% sure that people are not going to transmit is if they self-isolate for 14 days, as we have seen last summer with temporary foreign workers and international students, and none of those people transmitted out of all the cases that became positive on their day 10 test. So the risk is always, if somebody has tested negative on a certain day within that 14 days, then after that they can still become positive. So we're just trying to reduce risks at a time when the variants are increasing, and the variants are posing a very big danger right now in terms of trying to get our healthcare workers and our long-term care facility residents vaccinated prior to the variants becoming the big problem that we're seeing in other jurisdictions.
Thank you, Ms. Sutherland. Gilles Duval, TVA. Gilles?
Oh, bonjour.
Bonjour.
Excusez-moi. Oui, alors, des questions pour Dr. Russell. Si on passe du confinement total à la zone rouge, c'est que vous estimez que la situation est assez bien contrôlée pour pas qu'il y ait une propagation qui pourrait survenir bientôt?
Quelle zone vous décrivez? La zone 4?
Oh.
La zone 4?
Oui, la zone 4, Edmundston, nord-ouest.
Alors, la question, c'est quoi?
Tu répétais la question, Gilles?
Je disais, si on passe du confinement total à la phase rouge, c'est que vous estimez que la situation est assez bien contrôlée pour pas que y aurait autre propagation qui pourrait survenir?
Le risque est toujours là. C'est pas que le risque est zéro, mais on est rassuré par le nombre de cas qu'on voit maintenant qui sont liés à l'extérieur des foyers de soins à ce moment-ci. Mais les éclosions qui continuent dans les foyers de soins et les résidences à long terme nous concernent maintenant aussi. Et ça va continuer jusqu'à temps que les éclosions sont déclarées terminées. Alors, je ne sais pas combien longtemps que ça va prendre, mais je sais qu'il y a des gens qui sont fatigués à ce moment-ci. C'est un gros travail. Alors, on va continuer à surveiller cette situation-là. Mais oui, avec tous les déclencheurs qu'on avait, puis la résolution au niveau de le rétablissement d'aller dans la phase rouge, on est contente avec le progrès qui a été fait.
Monsieur Duval, as-tu suivi?
Oui, plus précisément, donc, pour le manoir Bellevue et la Villa des Jardins, est-ce que vous estimez que ça va mieux actuellement ou que c'est pareil au même ou que c'est encore très inquiétant?
Le protocole pour faire les dépistages chaque 2-3 jours, ça, c'est la façon qu'on détermine combien longtemps on a besoin de garder de suivre l'éclosion. Je ne sais pas vraiment combien longtemps que ça va prendre, mais d'habitude, c'est 14 jours de dépistage. Puis après 14 jours de dépistage, si on voit des améliorations, c'est beau, mais vraiment, il faut vraiment avoir 0 cas à un moment donné. Alors, ça nous inquiétera jusqu'à temps qu'on a 0 cas dans les foyers de soins.
Merci, M. Duval. Tom Bateman, Brunswick News.
Oh, hi there. I wonder if we can have kind of an update on for how long the entire province must remain in the orange level before Dr. Russell and your colleagues consider expanding or kind of, loosening the restrictions, maybe to something like the Atlantic bubble or that sort of thing. What kind of timeline do you have, given the presence of the variant here?
Thanks for that question. Really, right now, we're not indicating when yellow could happen. Our goal right now is to get the entire province into orange, and we know that orange will be the near foreseeable future. And that's because of the variant. We need to understand what our condition is, and I'm sure public health will let us know when they feel we have the opportunity to go into yellow. I know that everyone in this province would like to not only be back into yellow, but have the opportunity to travel within our Atlantic bubble. So that's our goal. I think it would be wrong to anticipate that it could only be a week or 2 or 3.
Mr. Bateman, do you have a follow-up?
Yes, I do. We were all warned about the risk associated with gathering during the Super Bowl yesterday. I just wonder, Minister Shepherd, perhaps if you had an update on how we did. No, here we go. You guys hear me?
Can you repeat your question?
Yeah, should I wait?
I'll try and call him.
Sure.
Go ahead, Tom.
Okay, thanks. Yeah, I'm just wondering about the Super Bowl. Did New Brunswickers heed your warning, Dr. Russell and Minister Shepherd, to gather, within their family, or, did you have people out on the streets kind of looking for, lots of cars parked at homes and that sort of thing? How did New Brunswick do that way?
I think if I were a Benton girl, I'd say that the majority of the people in our province really respected public health parameters, and we're grateful for that. We have to consider now that we have Family Day coming up and we have March break, and we would like to have the same kind of collaboration from New Brunswickers on these upcoming provincial holidays and times. So we know how hard this is, but it's been my impression that we did good.
So were there any fines or anything? Was there any compliance of?
I'm just going to
any information?
I didn't hear anything like that, Tom, but that doesn't mean that it didn't happen. I just didn't hear about it, but certainly the numbers will tell us in probably about 7 to 10 days.
Thank you, Doctor.
Okay,
Thank
I'll
you.
ask Glenn. Thank you.
Simon Delatte, l'Acadie Nouvelle.
Bonjour, une question pour la docteure Russell. Depuis le début de la pandémie, on semble voir des éclosions plus sérieuses dans les foyers de soins. Est-ce qu'on a une explication de pourquoi ce phénomène?
Vous voulez savoir pourquoi que les éclosions sont plus sévères dans les foyers de soins?
Oui.
C'est parce que la population est plus vulnérable. C'est les gens les plus âgés qui sont plus à risque d'avoir des symptômes très sérieux et sévères de le COVID-19. Et c'est cette population qui est plus à risque pour les décès aussi. Alors, c'est vraiment quelque chose que je suis tellement fière des équipes promptes qui ont vraiment réussi à gérer toutes les situations avec des éclosions dans les foyers de soins, et ça va continuer à être la façon qu'on essaie de gérer la situation. Mais avec les variants qui s'en viennent, ça va être plus difficile. C'est pour ça qu'on aimerait avoir les gens qui sont dans les foyers de soins vaccinés le plus tôt possible.
Monsieur Delatte, as-tu un suivi?
Oui, si tous les résidents d'un foyer ont été vaccinés, pourquoi ne pas permettre les visites ou faciliter les contacts avec leur famille?
Ça, c'est quelque chose qui va continuer à évoluer parce qu'on aura plus d'informations. Mais l'information qu'on a aujourd'hui, c'est que seulement les gens qui ont été vaccinés se sont protégés. Alors, ça veut dire que c'est possible que quelqu'un qui a eu le vaccin peut devenir positif pour le COVID-19 et ils peuvent le transmettre. Alors, peut-être eux-mêmes, ils ne vont pas devenir très malades, mais ils peuvent le transmettre à d'autres gens et eux peuvent devenir malades. Alors, il faut respecter les directives, même si vous avez le vaccin à ce moment-ci.
Merci, Monsieur Delat. Vicky Hogarth, CHCO.
Thank you, Bruce. My question is either for Dr. Russell or Minister Shepherd. I'm looking for clarity on whether or not New Brunswick residents who cross the international border to work in Maine daily will now be subject to weekly testing. And if so, will they be able to get tested in their own community, or will they have to travel to the city? And will they have a scheduled weekly appointment, and how will compliance be monitored?
So Vicki, it's my understanding that yes, they will have to be tested weekly. We are working on a couple of different avenues to bring testing closer to every community with workers that we depend, we rely on to, especially in our medical field. And so we should have more information on that coming in the very few days. The task force is working under, under a few possibilities is the word I'm looking for, a few possibilities to bring the testing closer to those travelers, potentially in local pharmacies and that kind of thing. So we're looking at different options to make it more convenient to make those tests available. So we'll be looking at local hospitals and any opportunity that we can to do it and make it easier.
Do you have a quick follow-up, Ms. Hogarth?
Yes, thank you. Since we will likely not be able to return to the yellow level for quite some time, can friends and family who live in different orange zones include each other on their list of study 10? Can we travel between orange zones to visit loved ones?
Doctor?
We are asking individuals not to cross zones.
Thank you, Ms. Hogarth. Eloise Rodriguez, Radio-Canada.
Oui, bonjour, Dr. Russell. Pouvez-vous nous dire combien de personnes sont en isolement en ce moment au Nouveau-Brunswick et combien de travailleurs de la santé sont en isolement?
Vous voulez savoir combien de travailleurs de santé sont en confinement?
En isolement, soit parce qu'ils ont été en contact ou parce qu'ils ont la COVID, mais combien de travailleurs de la santé et combien de personnes en tout au Nouveau-Brunswick aussi?
OK. Alors, en total, il y a 912 personnes qui sont en confinement aujourd'hui et de 912, il y a 51 travailleurs de santé.
Tu as suivi, Eloise?
Oui, merci. Toujours pour la docteure Russell, je voudrais vous entendre qualifier la situation au Nouveau-Brunswick en ce moment. Est-ce que, avec ce qu'on voit en ce moment, les résidents du Nouveau-Brunswick peuvent comprendre que le pire est passé?
Je n'ai pas entendu la question.
Peux-tu parler plus fort, Eloise, au micro, s'il vous plaît?
Oui. Est-ce que là, vous m'entendez?
Oui.
J'aimerais que vous qualifiez la situation au Nouveau-Brunswick, parce qu'on a vu une très grande augmentation le temps des fêtes. Là, ça redescend. Est-ce que les résidents du Nouveau-Brunswick peuvent comprendre que le pire est derrière eux?
Oh, non. Non, j'aimerais dire que le pire est en arrière de nous maintenant, mais c'est pas vrai parce qu'on a les variants qui peuvent se rendre ici et on sait que s'il y a une éclosion qui est causée par un des variants, ça va être plus grand, plus gros, plus nombreux de personnes qui seront touchées. Et à cause de le nombre de cas qui sera augmenté, ça veut dire qu'il y aura plus de gens qui auront besoin d'être hospitalisés. Il y aura plus de gens qui auront besoin de les soins intensifs. Et ça veut dire qu'il y aura peut-être plus de décès aussi. Alors, je crois qu'on a des semaines et des mois devant nous avec des risques qui sont plus élevés. En même temps qu'on essaie de dérouler notre programme d'immunisation.
Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, you mentioned you're discouraging moving around New Brunswick during March break. Now that almost all zones are in the orange phase, will you still be advising that people avoid all non-essential travel between zones at all times, not just March break, particularly in zones where the variant has been detected? And is there any discussion underway about enforced restrictions on travel between zones if variant cases start to climb?
Well, I'll start and then I'll let Minister Shepherd finish. At this time, our message is to not travel. And as Minister Shepherd has said many times, the virus moves with people. So if the people are moving, the virus is moving. So we want you to stay within your zone. We want you to stay within your steady 10. And those steady 10 are the people that you spend time with in close contact. And therefore, if one of you tests positive for COVID-19, all of you will be self-isolating for 2 weeks.
Just to build on what Dr. Russell has said, we know that the virus moves by people, and we have seen in the past, a case coming from one zone into another and then gets transmitted into a third. This has happened more than once, and we know that this is the risk. So we're asking and we're really advising that travel between zones just not happen if at all possible.
Ms. McKinnon, do you have a follow-up?
Yes, thank you. Minister Shepherd, you mentioned last week the government is preparing to have a public conversation about the seriousness of the variant. A conversation implies a two-way communication. Can you tell us a bit more about how this will be conducted or what we can expect?
I can tell you that it will be this week, and I'm going to defer you to Bruce McFarland as to how.
Thank you, Mr. Shepherd. Clara Pasica, Times and Transcript.
Good afternoon. My question is for Dr. Jennifer Russell. An Ontario couple is expecting the birth of their biological child through a surrogate who lives in Moncton, New Brunswick soon. The couple has been denied entry to the province for the birth and to receive and take home their biological child, even though they had a quarantine plan and applied in advance. They received the response that this does not meet the requirement of Chief Medical Officer of Health to grant entry to the province, leaving their soon-to-be newborn's care in jeopardy. Is this the intention of the policy, and if not, will you adjust the policy to confirm entrance will be allowed under these reasons?
I'm going to take that one, and just to say that be happy to receive the details and see if there's something that we can do, but I would not comment publicly that we would alter and make an exception. It will be based on the information provided.
Ms. Pasica, do you have a follow-up?
What message would you have for the couple of what they should do next? They've engaged a lawyer, and for the last week have been trying to contact public health to receive an answer. So what would be your advice for them?
I would just recommend that maybe they copy the minister on the correspondence, and we'll make sure they get an answer as soon as possible.
Thank you, Ms. Pasica. Thank you, Dr. Harry Forrestal, CBC.
Thank you, Bruce. This is for Dr. Russell. Dr. Russell, the 1918 flu came in 4 waves over 3 years. What is the expectation of COVID-19's behavior in the coming 24 to 36 months?
Well, it is really hard to predict, Harry. We have had conversations with various experts on what to expect, but it really is difficult to predict. So I think, we were expecting the second wave that has happened. I think we will have a third wave, but whether that's this spring or whether it's the fall and whether there's going to be a fourth wave, it is really hard to predict because there are so many different things that are happening all at once with respect to vaccine availability and the variants.
Mr. Forrestal, do you have a follow-up today?
I do, Bruce, thank you. Given that, and given the expectation of some microbiologists and other medical personnel that we're going to see COVID-19 develop into more of a flu-like pattern, how much longer do you think you can maintain the orange or yellow levels before we finally go to green?
Well, again, I think that keeps changing as well, again, based on the evolution of the situation with, again, the vaccine rollouts, variants, and the effectiveness of some of the vaccines on the different variants. And so my understanding is that the vaccine manufacturers are prepared to make new vaccines based on the changes. moving forward. So it could be that we will see ourselves needing to be vaccinated on a yearly basis, if not more frequently. But that's all we can really say right now based on the information that we have today.
Thank you, Mr. Forstall. Justin Szymanski-Langell, Telegraph-Journal.
Yes, thank you. My question is for either Dr. Russell or Minister Shepherd. How is the arrival of the UK variant expected to impact operations in hospitals and community health centres? And if there are going to be any operational changes made, can you kind of outline what those changes will look like? And overall, does New Brunswick have the medical capacity to handle any potential influx of COVID-19?
So I'm going to take that one. The introduction of the variant makes us more vigilant. It doesn't really change the protocol at this time. The very, very best way to defend against the variant and COVID-19, as we proved back in March, is to keep it out. And the fact is that that's why the restrictions and our travel restrictions are heightened, because once it gets into this province and gets transmitted beyond one person or two people, then the fact is there will be more cases. The more cases we have, the more pressure that puts on our healthcare system. And that's when you see mass surgery cancellations and different big changes in the protocol of our RHAs. So for now, it's about keeping it out. That's the very best protection we can provide New Brunswickers, and that's why we have the traveling strategy restrictions that we do.
Justin, do you have a follow-up?
Yes. Does the province feel that it has the medical capacity to deal with any significant influx of cases? And if we ever get to a worst-case scenario where we've exceeded our capacity for patients, what's the plan in that situation?
So I'm going to start and ask Dr. Russell to kind of pitch in here, because this is all about contingency plans, as you know. And even managing with the most recent outbreaks, being up to nearly 300 cases in the province, that actually stretched our tracing capacity to the max with our contingency plans. So we did it, but it was challenging. So I can only imagine that if the cases become a much higher number, there will be consequences to that. And I'll let Dr. Russell speak to maybe what discussions have taken place across the country.
So there is no question whatsoever that the variants will pose astronomical problems with our ability to manage it. So that is why, as Minister Shepherd said, we are trying to minimize the risk of travelers bringing COVID into the province at any cost, in terms of what are the maximum strengthening of our protocols can we use at this time to ensure that we are decreasing the risk as low as it can possibly be, knowing that we can't get it to zero. And when the variants arrive, which we know they will, they already have, and if they do cause an outbreak and it gets into a nursing home, we know that the risk to those residents is much, much, much higher right now. So, and as Minister Shepherd mentioned, those outbreaks do take a lot of horsepower in terms of trying to get them under control. And that's not with the variant at play. With the variant at play, it will tax us beyond what we've seen, and we're really trying to take all measures possible, and that's why we're trying to impress upon the public that anything you can do to reduce your risk, you really must do, because once the variant gets in and causes an outbreak, we will be at the mercy of those numbers rising exponentially, causing problems in nursing homes and more hospitalizations, more ICU admissions, and more deaths. And I predict that if that does happen, that we will see more measures that we would have to put in place to curb the spread and put more lockdowns in place around the province. And I don't want to see that. So we really have everything to gain from protecting ourselves as much as possible right now as a province.
Thank you. Thank you, Justin.
That concludes today's COVID-19 update for New Brunswick. So just for a quick recap, there were only 2 new cases today, and they were both in Zone 4, the Edmundston region. Now tonight at midnight, Zone 4 will leave the lockdown and move back to the red level of recovery, and Zone 1, that's the Moncton region, will roll back from red to the orange level of recovery. Now we were able to ask a question today about whether there is travel permitted between the zones. If you're in orange level, for instance, and you would like to visit a friend in another orange level and include them in your study tent, they are recommending against that. I will post on Facebook the next time we do have a conference to let you know as soon as I find out, and I look forward to joining you next time. I'm Vicki Hogarth from the CHCO News Desk.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.